Hey everyone, today I'm bringing you the mini pre-medical series, and today's lecture has to do with learning about the heart. So the outline for today's lecture would be the location of the heart, everyday connection CPR, shape and size of the heart, chambers and circulation through the heart. Understanding these basic concepts will help you learn how to read EKGs in the future. And you might ask, why is this useful to learn? Well, the heart sends blood around your body. The blood provides your body with the oxygen and nutrients it needs. It also carries away waste. Your heart is sort of like a pump or two pumps in one. This is a general topic every medical student covers with their professors in their foundational year. If you are considering studying medicine, this is only a small example of what you will be learning about. Now let's first go on to the location of the heart. Location of the heart. The human heart is located within the thoracic cavity, medially between the lungs in the space known as the mediastinum. Figure 1 shows the position of the heart within the thoracic cavity. Within the mediastin, the heart is separated from the other mediastinal structures by a tough membrane known as the pericardium or pericardial sac and sits in its own space called the pericardial cavity. The dorsal surface of the heart lies near the bodies of the vertebrae, and its interior surface sits deep to the sternum and costal cartilages, the great veins, the superior and inferior vena cava, and the great arteries. The aorta and pulmonary trunk are attached to the superior surface of the heart, called the base. The base of the heart is located at the level of the third costal cartilage, as seen in Figure 1. The inferior tip of the heart, the apex, lies just to the left of the sternum between the junction of the fourth and fifth ribs near their articulation with the costal cartilages. The right side of the heart is deflected anteriorly and the left side is deflected posteriorly. It is important to remember the position and orientation of the heart when placing a stethoscope on the chest of a patient and listening for heart sounds, and also when looking at images taken from a mid-sagittal perspective. The slight deviation of the apex to the left is reflected in a depression in the medial surface of the inferior lobe of the left lung called the cardiac notch. Everyday connection (CPR). The position of the heart in the torso between the vertebrae and sternum. See the image here for the position of the heart within the thorax. It allows you guys to apply an emergency technique known as cardiopulmonary resuscitation (CPR). If the heart of a patient should stop, by applying pressure with the flat portion of one hand on the sternum in the area between the lines in the image shown, it is possible to manually compress the blood within the heart enough to push some blood within it into the pulmonary systematic circuits. This is particularly critical for the brain, as irreversible damage and death of the neurons occur within minutes of loss of blood flow. Current standards call for compression of chest at least 5 centimeters deep and at a rate of 100 compressions per minute, a rate equal to beats. If you are unfamiliar, at this stage the emphasis is on performing high-quality chest compressions rather than providing artificial respiration. CPR is generally performed until the patient regains spontaneous contraction or is declared dead by an experienced healthcare professional. When performed by untrained or overzealous individuals, CPR can result in broken ribs or a broken sternum and can inflict additional severe damage on the patient. It is also possible, if the hands are placed too low on the sternum, to manually drive the sphygmomanoid process into the liver, a consequence that may prove fatal for the patient. Proper training is essential. This proven life-sustaining technique is so valuable that virtually all medical personnel, as well as concerned members of the public, should be certified and routinely recertified in its application. CPR courses are offered at a variety of locations, including colleges, hospitals, the American Red Cross, and some commercial companies. They normally include practice of the compression technique on a mannequin. Shape and size of the heart. The shape of the heart is similar to a pine cone, rather broad at superior surface and tapering to the apex. A typical heart is approximately the size of your fist, 12 centimeters, 5 inches in length, 8 centimeters, 3.5 inches wide, and 6 centimeters, 2.5 inches in thickness. Given the size differences between most members of the sexes, the weight of a female heart is approximately 250 to 300 grams, 9 to 11 ounces, and the weight of a male heart is approximately 300 to 350 grams, 11 to 12 ounces. The heart of a well-trained athlete, especially one specializing in aerobic sports, can be considerably larger than this. Cardiac muscle responds to exercise in a manner similar to that of a skeletal muscle. That is, exercise results in the addition of protein myofilaments that increase the size of the individual cells without their numbers, a concept called hypertrophy. Hearts of athletes can pump more blood effectively at lower rates than those of non-athletes. Enlarged hearts are not always a result of exercise. They can result from pathologies such as hypertrophic cardiomyopathy. The cause of an abnormally enlarged heart muscle is unknown, but the condition is often undiagnosed and can cause sudden death in apparently otherwise healthy young people. Chambers and circulation through the heart. The human heart consists of 4 chambers. The left side and the right side each have one atrium and one ventricle. Each of the upper chambers, the right atrium, plural atria, and the left atrium acts as a receiving chamber and contracts to push blood into the lower chambers, the right ventricle and the left ventricle. The ventricles serve as the primary pumping chambers of the heart, propelling blood to the lungs or to the rest of the body. There are 2 distinct but linked circuits in the human circulation called the pulmonary and systematic circuits. Although both circuits transport blood and everything it carries, we can initially view the circuits from the point of view of gases. The pulmonary circuit transports blood to and from the lungs, where it picks up oxygen and delivers carbon dioxide for exhalation. The systematic circuit transports oxygenated blood to virtually all of the tissues of the body and returns relatively deoxygenated blood and carbon dioxide to the heart to be sent back to the pulmonary circulation. The right ventricle pumps the oxygenated blood into the pulmonary trunk, which leads toward the lungs and bifurcates into the left and right pulmonary arteries. These vessels, in turn, branch many times before reaching the pulmonary capillaries, where a gas exchange occurs. Carbon dioxide exits the blood and oxygen enters. The pulmonary trunk arteries and their branches are the only arteries in the postnatal body that carry relatively deoxygenated blood. Highly oxygenated blood returning from the pulmonary capillaries in the lungs passes through a series of vessels that join together to form the pulmonary veins, the only postnatal veins in the body that carry highly oxygenated blood. The pulmonary veins conduct blood into the left atrium, which pumps the blood into the left ventricle, which in turn pumps oxygenated blood into the aorta and onto the many branches of the systematic circuit. Eventually, these will lead to the systematic capillaries, where exchange with the tissue fluid and cells of the body occurs. In this case, oxygen and nutrients exit the systematic capillaries to be used by the cells in their metabolic processes, and carbon dioxide and waste products will enter the blood. The blood exiting the systematic capillaries is lower in oxygen concentration than when it entered. The capillaries will ultimately unite to form venules, joining to form even ever larger veins, eventually flowing into the 2 major systematic veins, the superior vena cava and the inferior vena cava, which return blood to the right atrium. The blood in the superior and inferior vena cava flows into the right atrium, which pumps blood into the right ventricle. This process of blood circulation continues as long as the individual remains alive. Understanding the flow of blood through the pulmonary and systematic circuits is critical to all health professions. Remember, the art of medicine consists in amusing the patient, while nature cures the disease. Thank you everyone for watching. I hope all of you learned something about the heart.